Hi, everybody. My name is Krista Loos, the wellness dietitian here at KSB Hospital. And today I just wanted to talk a little bit about dietary supplements. So, kind of an overview of some of the things we'll be touching on today, just supplement safety in general, multivitamins, a little bit around specific vitamins, and then just some suggestions as a whole around supplements. And so diving into supplement safety. So, unfortunately, there are very minimal regulations on supplements as a whole. There's such a huge supplement market, but there's not very good regulations on supplements. And so, what we want to look for in supplements is third-party certified supplements. So, this image here is some of those common logos that are third-party certifying companies. So, essentially, what that means is that a company, so like USP, would come in and verify that what the supplement company is claiming is in the supplement actually is, that like the labels match to what they're saying, and that there's no banned substances or contaminants. So that NSF certification in informed sport, those are ones that test for the biggest kind of variety of banned substances. And then also too, like there might be a supplement brand, I'm going to use Nature Made for example, that has a lot of third-party certified supplements, but that doesn't mean every single supplement in that brand is certified. And so going to the websites of some of these supplements, you can search for a specific vitamin or mineral to see if that supplement is certified. And that's not to say if we have a supplement at home that maybe doesn't have one of these logos on it, that doesn't automatically mean that it's just like riddled with, contaminants or banned substances. We just don't have that extra safety net to say for sure. So, it might be something if you are taking a supplement regularly that the next time you purchase that supplement, might want to seek out a brand that has this third-party certification. And then with multivitamins, so do you need to take one? Is it something that everybody should be taking? I always kind of approach this with an it depends. There's lots of situations or food preferences or medical conditions going on that might warrant needing to take a multivitamin, but I always approach it with food first. Food is our most bioavailable source of vitamins and minerals, so if we can find some of these foods that we really like to help incorporate more vitamins and minerals, that's going to be the best way for us to be able to utilize some of those vitamins and minerals. There are some specific situations that I might suggest taking a multivitamin right off the bat. So pregnancy or prenatal nutrition. There are some very specific vitamins and minerals that help with that fetal development. So would most often suggest a multivitamin in that situation. And then if an individual has multiple food allergies where it's really limiting their ability to have variety in the food sources that they're consuming, it probably would be helpful to have a multivitamin as well. There's definitely other situations not on that list that a multivitamin could be helpful. So if you have questions specifically for you and your needs, I would encourage meeting with a dietitian to kind of ask and see if they think you have enough variety in your diet right now that you wouldn't warrant or need a multivitamin. And then for some specific vitamins and mineral, again, kind of an it depends situation. There are some in the next slide that I'll talk about that I might suggest for most individuals to take. But the form of the specific vitamin or mineral matters. There's differences in bioavailability depending on the form that the vitamin is coming in. There's also differences in how some people tolerate specific vitamin and mineral supplements. I'm just going to use magnesium as an example. There's lots of different forms of magnesium that help with different things. For example, like magnesium oxide and magnesium citrate can be helpful if an individual is experiencing constipation, but some people can experience very like loose stools or diarrhea when they have those forms of supplement, which we don't want to be happening. So everybody tolerates that a little bit differently. So again, very individualized when it comes to specific vitamins and minerals, and always encourage talking with a dietitian or your primary care provider to determine if a supplement is helpful or not. We also want to be aware of some vitamins and minerals that can be toxic if we have too much. We have some vitamins that are fat soluble that we will hold on to any extra of that vitamin if we're taking a high dose, versus we have some that are water soluble that if we have a large amount of that, we're likely just going to pee out any excess of that vitamin. Vitamin C would be an example of that, versus vitamin D would be an example of a fat soluble vitamin that we would hold on to extra. So it's always important to check kind of blood work for vitamin and mineral status, especially with some of those fat soluble vitamins, to make sure that a supplement is even necessary in that situation. So 2 vitamins that I typically would suggest with a vitamin D supplement, again, it is fat soluble, so I always encourage getting blood work done first to check that vitamin D status. It is one where food sources are relatively limited. So foods that are high in vitamin D would be like fatty fish, salmon, tuna, sardines. We get a very little bit in egg yolks, depending on the type of mushroom. If it's UV treated, we can get a pretty good amount of vitamin D there, but not all mushrooms are treated with kind of that UV exposure. And then some fortified like dairy products will have vitamin D, but even within that, it's kind of hard to meet our needs. So our primary source is from the sun, but where we live in Illinois, we're too far north to be able to utilize that sun in the winter. So it can be really helpful in the winter months to have that vitamin D supplement. Again, I would ask your primary care provider if they can check your vitamin D status before starting a supplement. The other one would be an omega-3 or fish oil supplement. The EPA and DHA come from fatty fish or algae, which is a vegan source. A lot of Americans don't eat enough of those fatty fishes to help meet our needs for some of those essential fatty acids or the omega-3s. Overall benefit of those: heart health, brain health, and inflammation. And so the 2 images here would be examples of some of those third-party certified supplements, which I would recommend for that supplement safety, and then also to kind of help meet our needs if we're not consuming a lot of the food sources that I mentioned. And that's all I have today on supplements. If you do have any questions, please feel free to reach out to me. I'd be happy to help answer those. And as always, thank you, KSB Community and Wellness, for hosting these nutrition topic educational videos. And then stay tuned for next month's nutrition topic. Thank you.